with you so that I would be in a better position to help you. Is that okay?
Yeah, doctor, sure.
Okay. So you told me regarding this, Lian, and you told me that you are unable to walk now and you are having a difficulty in sleeping because of that.
Yeah, doctor.
Okay. And is there anything, like you told me that it's getting worse with walking? Is there anything by which it's getting more worse?
I'm not aware of anything.
All right, no problem, John. And what kind of pain it is? Would you like to tell me?
It's just painful.
Okay. And if I ask you for now, you can score your pain on the scale of 1 to 10, where 1 is a least pain and 10 is being the highest one. How would you score your pain?
I think it is 3 or 4. But at
3
night
or
time, it is more.
all right. And are you taking anything, John, to make your condition better?
It's some over-the-counter painkillers. That's it.
Okay. And would you think it's helping you in any way?
Yeah, at night time, if I'm not taking painkiller, then I can't sleep because of pain.
Oh, I see. It could be very difficult for you. I can understand this. So, apart from pain in the legs, and is there anything else that is bothering you?
No, doctor.
Any swelling in over the leg?
No,
Any redness do you have?
no,
Okay. And do you feel any the skin over the leg is warm or cold?
no, doctor.
Okay. And do you feel that your veins over the legs are swollen and when you touch it, it is painful?
No.
Okay. So John, what do you think? What could be the reason of having this condition with you?
I don't know, doctor.
All right, no problem. So, John, would you like to tell me do you have any chest pain and shortness of breath along with that?
No, doctor.
Okay, any fever and flu-like condition?
No.
Okay, and how about your weight?
Yeah, I think I'm obese, doctor. Yeah.
Mm-hmm. And is it intentional or non-intentional?
It's just like I'm a teacher, and when I get back home,
Mm-hmm.
I'm very tired, so I don't do any physical activity.
Mm-hmm.
And yes, maybe because I love chips and burgers.
Okay. Okay. All right. And do you have any these condition from the last 6 months? So how about your life before that?
Um, it was okay.
All right. And any other medical condition that you are aware of, John?
No,
Like any problem with your blood pressure, any diabetes?
no,
Okay. And are you taking any medication apart from painkiller over the counter or any drug?
no,
Okay. Any previous trauma or surgery has been done?
no.
Okay. Have you traveled so far?
Yes, doctor. Uh, I'm driving to my job, and it's at least 1 hour away
Mm-hmm.
from my residence.
All right. So, John, would you like to tell me regarding your lifestyle? Do you smoke?
I'm just smoking 1 to 2 cigarettes per day. That's it.
Okay. And how about drinking alcohol?
No, I'm not drinking.
Okay. All right. And you
Two
told me
minutes
that you
remaining.
okay. So, thank you so much, John, for letting me know regarding your condition and getting help from us. Ideally, I would like to examine you if you are here from head to toe, and I would be checking your vitals, and I would like to run few investigations for you so that I'm in the position to understand what is causing your condition right now. Do you
Okay,
understand?
okay, doctor.
So, John, up till now, till our consultation, do you have any concern in your mind?
Actually, doctor, I told you that it's troubling me in my job, so it would be great if you can treat this condition.
Yeah. That's why, John, I would like to come to the clinic so that I can discuss the whole chat that I have with you with my senior. We might be in the position to arrange some test for you that we call ultrasound scan of your leg. How does it sound to you?
Mm-hmm. Okay.
Okay, so by this we will be able, and we will be running some blood tests as well to see what's causing your condition. And after the test has been done, we will be treating you accordingly.
The next station.
Oh,
I'm sorry, I couldn't manage the time properly.
it's so we will discuss the feedback at the end. Now I would like
Okay,
Dr. Radha to perform.
Yes,
okay.
I will.
Okay. Thank you, Nazish.
Thank you, Dr. Annie. Thank you so much.
You're welcome. Okay. So, Dr. Radha, am I pronouncing your name properly?
Yes, Gada.
All right. So, this is your
Okay.
task.
Okay. Uh, okay. Okay.
Start.
Okay.
Begin.
Hello, I'm Gada. I'm one of the doctors here. Can you come? Are you Mrs. Sarah?
Yeah, doctor.
Okay. Can you confirm your full name and date of birth, please?
Yes, doctor. My name is Sarah Benson and I am 52.
Pleasure to meet you, Mrs. Sarah. I can see from my records that you are here for the result of your blood test. Am I right?
Yeah, doctor.
Okay. I have your blood test results with me now, but I want to discuss a little bit with you about your condition, okay?
Mm-hmm.
Okay. Can you tell me from the start, why did you do these investigations in the first place?
Actually, doctor, I was having some diarrhea in
Mhm.
past 1 year. So I was having off and on episodes of diarrhea and I was having some cramps in my tummy. So I went to my GP and he did these tests for me.
Okay. Okay. And with along with this diarrhea, was there anything else apart from the abdominal discomfort that you mentioned?
No, doctor.
Okay. Was there any blood did you notice in your poo?
No.
Okay. Did you lost much more weight?
Yeah, people are telling me that I'm losing weight as well, but I have not checked that.
Okay. So do you feel that your clothes is so wide right now?
Yeah, you can say that.
Oh, okay. And this was not intentional.
No, no.
Okay. So with this, did you notice any lumps or bumps all over your body?
No,
Okay. Any heart racing or
no,
dizziness?
no.
Okay, great. Okay. Okay. So, and then they asked you to do the
Yeah,
investigation.
correct.
Okay. Okay. And how are you feeling right now?
Yeah, I'm better.
Okay. Is the diarrhea still continuous?
Yeah, doctor. Actually, I'm having at least 3 to 4 episodes of diarrhea per week. So
Uh-huh.
it is there. Yeah.
Okay. Can you relate this diarrhea with any certain types of food?
Um, I'm not sure if it is relevant or not, but I think when I'm eating cereals and pastas and breads,
Uh-huh.
then it's worse.
Okay. 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 You are you are brilliant to get a relation with this. Okay, so I would like to examine you. I will take your vitals and I will take your body mass index, which is indication about your weight and a relation between your weight and height. Okay,
Mm-hmm.
okay. And I will discuss the investigation with you right now. But before that, do you have any idea or any specific concern before discussing this?
Um, doctor, this diarrhea is very troublesome for me. I cannot go out for a longer period of time. So it would be great if you can do something.
Okay, okay. I will go for this right now. You mentioned that this diarrhea is troubling your life.
Yeah, correct.
Yes. Can you tell me if you work or not?
Yeah, doctor, I'm working as a secretary in the office.
Sorry, I couldn't hear you.
I'm working in an office.
Yeah, okay. So, are you physically active, or because the nature of your work, you are still sitting for a long time?
No, I'm sitting for a long time.
Okay, okay. So do you have any other medical condition?
No,
Okay. Are you in any medication?
no,
Do you have any allergies?
no.
Is there any family history in your family with such a condition?
Oh, yeah, doctor, now you have asked me. My brother is also having a condition called, I think, celiac disease.
Uh-huh. Okay. Okay. So do you think is that you have the same condition? Do you have this idea crossed your mind?
Yeah, it might be.
Okay. So how far do you know about this celiac disease?
Um, I think he's having a specific kind of food, like he cannot eat these pastas and cereals and all these things. They have given him some diet plan.
Yes, you are quite right. So now I will tell you the result of your investigation. Fortunately, the full blood count and your kidney function and the liver function are totally normal, and that's good. Okay.
Mhm.
And but the specific test, which is the transglutaminase, okay, it's positive. Okay, and the anti-gliadin antibody is also positive, and these indicates that you have celiac disease. Most probably you have a celiac disease. Okay.
Yeah, doctor.
Yeah. Okay. So for the time being, okay, we will need to do more further investigation to confirm your diagnosis. Okay, which is an endoscopy. So how does it sound for you?
Oh, what is endoscopy, doctor?
Yes, it's like a camera to go inside your the large bowel of you, okay, and take some samples to see the nature of the cells of your from your colon, from your large bowel.
Do I really need to do that test, doctor? I'm so scared of that test.
Yes, actually, at the time being, we need to do this. I know that you are scared and you may bust all of this with your brother, who is I hope that he is well and fine now. But you need to do this endoscopy to confirm his diagnosis.
But doctor, you are telling me that you have already done these blood tests, and what's the need of endoscopy? Can you please skip that, doctor? It's so uncomfortable.
Yes, I know. I know that feeling like a camera or something like this will intrude your body, maybe a little bit scary. But these endoscopy, as I told you, when we make a diagnosis, it's like a puzzle. So we need to put all of the blocks beside each other to have a final diagnosis. So this test is suggestive, and we need a confirmatory test to be able and 100% pretty sure that you have this condition. So what do you think about this?
But doctor, there might be some other way, isn't it?
Actually, as far as the Okay.
Very good.
Okay.
That was really good. So let's talk about the feedbacks now.
Okay.
Okay, so let's do this station first, and then we will do the previous one. Okay. Yes, Dr. Radha, your history taking was very good. Okay, let's talk about your positive things first. You followed the proper protocol for history taking. You ruled out red flags. You talked about past medical history. You talked about impact on my life as well. These were really good points. But the only thing which I'm concerned about is your timekeeping. Because that is not a history taking case. You were at 5 minutes, you were still talking about history. So it would be great if you can start.
Actually, I didn't hear any alarming bell.
Really? Oh.
Yes. For that reason, I continued till the end. I felt that the end ring is the alarming one. I didn't realize after you said good, and you finished.
Oh. Because sometime when you are performing, you cannot. It happened to me as well. I couldn't hear the bell under the exam pressure, But still,
Okay.
I'm happy with your consultation. You were not sounding scripted. Just a little bit. Can you please mute yourself? Anyone who is talking except Dr. Radha?
No.
Yes. Who is talking? Sorry. Dr. Anne. Okay, thank you. So yeah, so the only thing that I'm concerned about is your timekeeping. Try to keep your data gathering short, at least for 3 minutes, not more than that. Because if you see the task, your task first part is talk to her. That is the data gathering. Second thing is disclose investigations. Third thing is talk about endoscopy. Fourth thing is talk about gluten-free diet. So these are your 4 things that you have to cover in this station. Okay. So it would be great if you can make your data gathering a little bit shorter, just in 3 minutes, not more than that.
Okay.
And the questions you can hear, you talked me about my job. That was, you can skip that question. When you asked me about quick recap and current symptoms, any new symptoms, that was really good. You cannot skip that part. But in red flags, you asked me about blood, you asked me about weight loss, you asked me about anemia symptoms. I think that's enough in flaws. If you are trying to cover the flaws, don't forget the blood in stools, anemia symptoms, and weight loss you asked me. Okay, so rest of the flaws you can skip. And then once you have disclosed that, okay, so the question about that was good. If you have time, you can ask me, like, do you have any idea about celiac disease? Before disclosure, you were asking me. I think it's better to disclose, like, from these tests, we are suspecting that you are having celiac disease, and then ask her if she knows about it or not, to save your time. Okay. And next thing was endoscopy. So that was good that you were telling me it's important to confirm the diagnosis. It will be a little bit comfortable, but give the solution. Although it is a very small camera, which we are going to put in your food pipe, but mostly we put a numbing medication inside your throat to numb it. So you will not be feeling anything.
Yeah,
I
remember the endoscopy wrong. I missed the site of endoscopy. It's an upper GI endoscopy, not a lower GI endoscopy. So I was confused about this.
Okay. Yeah. So if you are talking about lower GIT imaging, then that will be sigmoidoscopy. Okay, or it can be colonoscopy. So when we are talking about endoscopy, specifically in the celiac disease, because upper part of the small intestine is we are looking for. That's
I know that.
All right. So you can tell her that we can give her some numbing medication to numb her throat. Similarly, you can tell her that if you want, we can give you some medication to relax yourself. some sleep medication, mild sleep medication to help you relax during the procedure. And once you have told this, next line should be, please bring someone with you at the time of endoscopy. Because after endoscopy, it's not safe for you to drive back. It's not safe for you to drive any heavy machinery. You will be also giving her some leaflets regarding endoscopy. She can read the indications and all the information about endoscopy. In this way, you can make your endoscopy part concise, talking about leaflets, okay?
Okay.
And third thing was gluten-free diet. You covered that. So you covered that, like, are you aware? That was really good. You used that point that your brother is on that diet. So are you having any idea? That's the best thing. Only thing that I'm concerned is about your timekeeping, and rest of the things were very good in here.
Okay. Thank you.
Yeah, you are welcome. Okay, Dr. Aisha has raised hand. Do you want to ask any question? All right, so let's start a new meeting and then we will be discussing about the next station in that meeting.
So same link, Dr. Annie?
No, I will give a new link.
Okay.
Okay.
Hello, Dr. Purat.
Yes.
I have a question regarding this, the first station, the varicose vein. Do you think,
Dr. Anne, we have not discussed the feedback about that varicose vein. It would be great if you can ask the question about varicose vein after that. Okay.
All right. It was just pinching in my mind. Just
Yeah,
your
okay.
yes or no. Do you think it is important to rule out blood clot in that station?
Yeah. Because
okay.
DVT and varicose veins are very similar, you know, both are on that. And so
yeah,
it
that
will be
I
on
was
DD.
just, it was banging in my mind. I am just remembering it right or wrong. Thank you so much.
Yeah, it was DD here.
Yeah, okay.
Okay, Dr. Aisha, do you want to ask anything? I can see that you have raised your hand. All right, so let's start a new meeting.